So the next muscle in our series of muscles that I think that you should really know about and that can really help people is Adductor Longus. It is the biggest and strongest of the adductors, and we'll talk a little bit about the attachments next. Okay, so it's going to attach to the ramus of the pubis, and in fact it's going to come all the way down from the pubic bone right up in here, and you can really, from the middle pant seam, if you just put your fingers up into the upper part, is the biggest, ropiest thing that you'll feel under your fingers. That is, it's the easiest to find and the simplest. On almost everybody, it's going to be very tight and ropey. All right, and so if I ask you to fire your knee into here, you can see Adductor Longus right here between my fingers is popping out and very, very tight and strong. And so again, that goes all the way up to the pubic bone and comes down roughly to about here. So the middle of the femur or so, although on some people it can go a little farther. I think on yours is actually a little lower than a lot of people's. So right about there is going to be the insertion, the origin all the way up at the pubic bone. There's a lot of different ways to get into here, but I would say one of the easiest to just and most effective ways is with the leg in this position. If I take my forearm and just rest the flat of my forearm directly horizontally across, so perpendicular to the muscle, and you don't have to use a lot of pressure at all, just a tiny, tiny bit is going to be pretty intense, you know, and I can just lean here. And then if it feels like, if the client is up for it, you can have them fire a little bit into you and then release. And then just sink a little bit more into it. And that in and of itself is going to be pretty impactful. You don't need to do a lot with it, you just need to tell the brain, hey, do you notice how tight this is? Maybe you want to let it go. Fire again, let go. Breathe. Okay. Yeah. Whew.